All right. Hello, hello, and welcome back. We are really happy that you guys could join us on today. So, do what you normally do. Go ahead and drop down in the chat, say hello, tell us where you are watching from. I'm always, fascinated about the weather. If you want to tell me what the weather is like in your parts, go ahead and tell us. But today, what we want to know is what have you heard about birth control? Listen, the streets are talking. Y'all are talking. You guys are bringing that information back to us. So go ahead, tell us, what have you heard about birth control? Have you heard that it causes weight gain? It's going to, it's the only reason that people are taking it is because they want to prevent pregnancy. There are issues with mood swings. What is it that you have heard? Because today we want to talk about the truth behind birth control. If this is your first time joining us, I am Dr. Ashley Booth. I am a board certified family medicine physician, and I am your host today. This is Lessons Beyond the Stethoscope. And here we provide practical tips and tools that you can use in your everyday life, because what we understand is that your life ultimately affects your health. This is episode 17, Beyond the Pill, the truth about birth control, uses, types, and side effects. And today we have joining us is Dr. Jaleen Sims. She is a practicing board certified OBGYN or obstetrician gynecologist at the Jackson Hines Comprehensive Health Center in Jackson, Mississippi. And she is passionate about ensuring that women are empowered, healthy, and fabulous. Okay. So thank you so much for joining us today, Dr. Sims.
Thank you so much for having me. I am so excited to talk about birth control because let me tell you, the streets shall be talking, and we're going to tell the truth today.
Thank you. That's right. Well, like what I like to do when I start off anything is just the basics, because we can talk about all the things, but what are we talking about? So we're talking about birth control. What exactly is birth control?
So, birth control is okay, so that is part of it. Birth control is a hormone or a non hormone that you will use to help, number one, prevent pregnancy. And then there are other uses for those types of birth controls in order to help you with like your periods or acne or things like that. So that's the overall scheme of things. And we'll get a little deeper here soon.
Okay. So tell me, how does it work? Because I know there are lots of different types and stuff like that, and we'll talk about that a little bit later. But how does, just taking it part by part, how does it actually work?
Okay. So the hormonal birth control actually changes the hormones in your system. So basically, your brain and your ovaries, they communicate. And as they communicate, they create a cycle in which you ovulate and you have your menstrual cycle. So when you actually take your birth control, it modifies that. And as a result, it leads to a decrease in ovulation or no ovulation at all. Basically, that's the goal of it for most birth control. Is it stops your ovulation cycle, and as a result, you don't get pregnant with intercourse. Now, there are some non-hormonal birth controls, and how those work for the most part is that they change the pH of the vagina, and as a result, it makes the sperm inactive, and so that it can't like go into the reproductive tract so that it can, fertilize an egg. And so those are the way the two types of birth control work: hormonal, non-hormonal.
Okay. And then from the hormonal versus non-hormonal, what are the different types of those? Because I know that we have, I'm not even going to get into it because I'm going to let you tell us. But what are the different types of those that we have?
Well, I'm glad you asked because I have a little handout here that I love to give to my patients, and I'll actually just kind of go through these. And so this is actually from like what works really well to like medium well and like not so well at all. So y'all see pull and pray at the bottom? Pull and pray,
Mm,
pull and pray. And y'all see the stars? Not very well. Condoms, because y'all don't be wearing condoms. That's why they are in that category. So, okay, so non-hormonal birth control. That would be like the copper IUD, as you see on that top row. That just, it has no hormones in it, and it has that copper that actually makes the sperm inactive, and that's how that works. It just kind of makes an inflammation for the sperm, and it creates a, an unsatisfactory environment for the sperm to survive and thrive. Another form of non-hormonal birth control on this paper would be, of course, the pull and pray. Pretty much everything on the bottom. So the pull out method, the fertility awareness. Now, what is fertility awareness? So if you use a period tracker and you know when your ovulation is, this is for people that have pretty regular periods. For people that don't have regular periods, the period trackers are not going to be as useful for you, because it's only estimating the time at which it thinks that you're going to ovulate. It doesn't give like really, really good accuracy, but it gives that little 5 to 6 day window in which the fertility for you would be pretty high. And those are the days that you want to avoid intercourse. Now, alternatively, if you are looking to get pregnant, those are the days that you want to have sex. And so that's what the fertility awareness is. Then there are two types of condoms. There are female condoms where you'll carry them, you'll put them in right before intercourse and you use it. Or there's the male condom. And of course, that's the one that everybody pretty much knows about. There is another one out there called Phexxi, or spermicide. Basically, you can get that over the counter. Phexxi is one that your prescriber would send to your pharmacy. But basically how those works is it's a very acidic, it has very acidic contents. And of course, the pH of the vagina is acidic. Well, semen is basic. And so as a result, when semen touches the vagina with the spermicide or the Phexxi or whatever inside the vagina, it kills it. So it doesn't allow it to have its normal, motility and fertilizing capacity. And so those are also pretty good as long as you use it every single time. Now, going on to the hormonal, there's two different types. There's the progesterone only. And I would say that those are going to be best for really anybody. I mean, but if you are a person that has like diabetes, hypertension, you are greater than 35 and you use tobacco, things like that, then a progesterone only birth control would be the best option for you. And that would include like your IUDs. Those are going to be the hormone IUDs. The next one, so the IUD, they last between 5 to 8 years. And then the implant, which is all the way over here, that's the one that goes inside the arm. And that lasts for 3 years. But there's currently research being done. And so, like, say you get it placed today, by the time it's time to come out in 3 years, it's going to be 4 years probably. And so you have that. And then the shot. That is also, so the depot shot is also the other term for that people use, but that's also a progesterone only. Then there's a pill. Some people call it the mini pill. So it's a progesterone only pill. So all of those are available in progesterone only. Now, if you're wanting something that is combo, then you have the pills, the patch, and the ring. Those are all right here on this second row. So the pill, the patch, and the ring. And those are all differently. Like the ring, you put it in the vagina. It's like a silicone rubber structure. You put it inside the vagina. It stays for 3 weeks. And when it comes out, it's time for a period. The patch, you put a new one on your skin each week. And then 1 week, you don't have one. So 3 weeks on, 1 week off. During that week off, you have your period. Then the pill, child, remember that. You got to take it every single day. Set those alarms, ladies.
That's right, because I was going to mention that and talk about how important is it not only to take it every day, but take it around the same time every day. Because some people say, oh, I'll just take it this morning, then tomorrow I'll take it tomorrow night. And so talk about that. Is it important to take it around the same time every day?
So yes, and there's a little caveat to it. So it depends on the type of progesterone that you have in your pill. So there's different types of progesterone. Some that offer a little bit more grace, and some that have hardly no grace. And so typically the ones that are covered by my patient population are the ones that don't have as much grace included in them. And so I just try to tell everybody so we don't have to try to say, oh, well, you can have a little bit more time and you only got 2 hours. to just tell everybody to try to take it within a 2-hour window every single day, because you just want to be sure. So you set your alarm for a time that you're typically free. So if that means first thing in the morning when you wake up, or if that means doing it, at nighttime when you're typically free, then just set that alarm, and then you'll know when to take it within that 2-hour window.
Okay. And then I want to go back to the IUD. We're saying IUD. I don't know if everyone knows what an IUD is and
Mhm.
where it goes. I know you talked about the one that goes in your arm, our neck plans, but what exactly is an IUD and where do you actually put that?
So an IUD is an intrauterine device. So that means that you put it inside the womb, or where the baby would live if you were pregnant, and it stays there. So you have to have that done inside of an office. It's almost like getting a pap smear, the way that we set you up and we just put it in, and there's like strings that stay outside of your cervix, but they're not outside of the vagina. So you've got your vaginal tube, and then you got your cervix at the top of it, and it just stays just a little bit beyond the cervix, but not outside the vagina. And partners won't feel it or anything through intercourse or anything like that. And so, yeah, you put it in, we cut the strings so they're nice and short, and then we just check it when you have your annual every year and things like that.
Okay. And I know on that paper, and that paper actually is pretty accurate as in terms of size of an IUD. Can you show
Mhm.
with your fingers about how big that device? Because everybody, when you think about something's going somewhere inside of you, like, oh my gosh, how big is it? And do I really want, am
Mhm.
I going to feel it? And like you said, you can't feel it, your partner can't feel it, but about how big is an IUD? Oh,
There's
okay.
This is an IUD that I actually wear on my badge. As you can see, my finger here, from the top to the bottom of the IUD, it's about an inch, a little over an inch. And this is two different types of IUD, but they're exactly the same size. There are some that there's one brand that's a little bit smaller, but for the most part, this is the size of the IUD. So it goes in, it stays in, and like you don't feel it, and you just have good birth control for multiple years. So it's called a LARC, long acting reversible contraceptive. And the Nexplanon is also considered a LARC.
Okay. Perfect. I love it. So we have our non-hormonal, we have hormonal, and our hormonal, we have where they are combination with other hormones, or you can have just your progesterone ones, and then they come in different forms. So you like giving us all of that. Now that we are taking it, and some people are taking it, let's say, to prevent pregnancy, but what are some of the other uses that someone may get on control? Because this is, and I'm just gonna get on my soapbox for just a second and then I'll get off. But this is one of my concerns about people withholding birth control and say, I don't believe in giving it out. Like there's been pharmacies that have been said, people say, I'm not going to fill that prescription. And it's because they're under the impression that it's only for pregnancies. And I don't want to be a part of the process to prevent a pregnancy. And I understand that. But what people don't understand is that there are other uses for it. And
Mhm.
we should not have to be privy to someone else's business to know why they are getting a medication. So can you tell us what are some of the other reasons why someone could potentially be on birth control, or what I like to call contraceptive measures and stuff as well? What are some of those reasons?
Yeah, so I would say the most common is irregular periods. And that is probably one of the most, well, the most common that I see in my clinic for young people. And so I have had young ladies in their 13, 14, 15 years old that were having to put on hormone therapy. And that's what I call it, because I ain't telling you can have sex. Okay. I
Right.
didn't say you can have sex because you own it. And that's how I
Right.
talk to them. I say, look, I know you're not sexually active, but just because we're putting you on hormones, we're not giving you the permission to have sex, since you won't get pregnant, because you can still get an STD. That's another
Mm-hmm.
story. But yeah, so to regulate menstrual cycles, that's one of the main reasons. Now, another part of that, there's so many reasons why people have abnormal periods. Like some of it could be like when the person is like an adolescent, their periods are just getting started. So their brain and their ovaries, the communication between the two hasn't quite matured yet. And so as a result, their periods are irregular. That's one part. The next part is like fibroids and polyps and all kinds of other things that brings in a whole different topic. So either way it goes, it all boils down to the fact that someone is having irregular periods and they're hoping for a more regular menstrual cycle, something that's more predictable for them. Another reason is painful periods. I'll see a lot of adolescents get on it for that as well. Like when I see a young lady who is like, I'm a great student, I'm doing a great job in school, but like when I have my period, it's
Mm.
almost like I have to stay home. I can't do any my normal activities, and we place them on hormones to help them to like decrease the flow from their cycles plus decrease the pain from their cycles, and they thrive after that.
Mm.
Another reason is acne. I've actually seen where, adolescents, they're like, okay, what can we do about my acne? Well, the hormones that your body releases from your ovaries, they're also steroids. Um, the male hormone testosterone can also be blocked, or progesterone can be blocked, the ones that's inside of your system, by the hormones that we can give you in your birth control pills. So as a result, you can see some clearing of the skin from us blocking those hormones that create acne.
Okay. And I like the explanation because I think even some adults honestly do not understand how debilitating this can be for people. We have also seen, like you talked about, painful periods and people having to miss school or miss work for it. The other
Hmm.
thing is the heavy bleeding. A lot of
Hmm.
people having to get blood transfusions. I don't think people truly understand
Yeah.
how this affects your quality of life.
Right, right. I mean, there's sometimes where I see people and they're like, yeah, my periods are really heavy, and they're like doing fine. It's just that during their periods, they're having to wear the pins. And when
Mhm.
you place them on hormone therapy, it can help to decrease their flow from their periods. And that gives an opportunity for us to like give them iron or blood transfusion if needed to help boost them back up. And sometimes people won't even realize how low they are because their body is so compensating. Like the body is compensating to like the level of iron that they have in their system. And it just continues to get lower and lower. And so once you boost them back up and get their periods lower, they're like, man, I just have so much more energy. And you check their blood count, and it's like, yeah, it's like 3 or 4 points higher than what it was when you first started. So, like, yeah, it's like a real thing. When you start to notice that, you're fatigued all the time, your periods are heavy, then hormones may be right for you. Just depends, you just talk to your provider to figure out what options are available to you and what you're a good candidate for. One thing that I'll also mention is that the IUD, the Mirena IUD, it's actually FDA approved for heavy menstrual bleeding.
Mm.
So yeah, it's not just for your birth control. Like they actually have it for heavy menstrual bleeding, and on average, it can decrease the flow from your menstrual cycle for 60 to 80%. That's significant.
Mm. That's huge. 60
Yeah.
to 80%. You
Hmm.
guys, I am talking with Dr. Jaleen Sims. She is a board certified OBGYN. Thank you so much for watching. I see people chiming in saying this is some great information. If you have any questions as we are discussing this, put them in here now because you have a mom, yourself, a sister, a cousin, somebody who is dealing with an issue and you want to know like, oh, how do we handle this? What should we ask our doctor the next time we go? Which option would make the most sense? So go ahead and put that in there now. Because we're talking about, if you're just tuning in, we're talking about birth control and the truth about it, the different uses, side effects, things of that nature. But since you've talked about all these different uses and the hormonal therapy and how it can help, what are some side effects? Because we do know that there are some side effects that can come along with it. And the list can be forever long. But
Yeah.
what are the most common ones that you see?
So when you mentioned that the list can be long and long, it made me think about commercials when they were like, if you experience it, and then all of a sudden you're like, wait, I don't want to take any of that. So when I say these things, I mention that because I don't want y'all to be getting stirred. So although you can have birth control for irregular periods, it can also cause you to have irregular periods. And let me tell you why. So progesterone only birth control doesn't have the estrogen in it, which actually helps to stabilize the lining of the uterus and keep your periods more regular. So the progesterone only, what will happen is for the first probably 3 to 6 months, some people way less, can have like some irregular bleeding, and that can look like just daily spotting. It can look like just kind of like a prolonged period that goes into some spotting. And then after that, 30% of people have no more periods. 30% have just spots when it's time for a period, where you can just wear a little panty liner during your period time and you're like straight. And then you got your 30% that do whatever they're going to do. You have no idea what it's going to be until they come and tell you. That means that they can have like no period for several months, and then boom, they have like a heavy one, or they can have no period for several months and then just have have one little light one, or like kind of like a prolonged light one. And all of that is considered to be very, very common and normal with progesterone only birth control. Now, one of the things that I want to mention here, because y'all heard me say that 30% of people have no more periods when they get on the progesterone only. So that would be one of the IUDs, the implant or the Nexplanon, and the shot or the pills. You do not have to have a period every month. You don't have to be cleaned out. That's what my patients say, cleaned out. You don't have to do that every single month. The reason why is because the progesterone actually thins out the lining of the uterus to the point where when it's time for a period, there's nothing to shed. So how the estrogen works is it thickens it up to get it ready for a pregnancy. And when you don't get pregnant, it thins it out through your period. And so that's how the hormones work in balance with one another to help you have periods every single month. But like I said, when you don't have that estrogen there and you have the progesterone only, it thins it out. And that's what makes you not have a period or makes you have like little spotting. And some people will say, well, I didn't have a period. I just spotted. That was your period. I came to, PSA, that was your period. Even if it's like little brown spots, that's old blood that just decided it was going to come out from the little blood vessels in your uterus. And that's all you have for the month. Some of the other side effects, now that we talked about the periods, or like how the bleeding can become nausea, vomiting, headaches, mood swings, things like that. I have actually seen where like people that maybe have changes in like their mood, where we've just switched them to a different one and they've done fine with it. There are different dosages of birth control. So like if you're on a combo pill, you can have like a low dose, like a low dose. You can have like a medium dose. You can have higher doses. You can have the ones where they like alternate each week, or they like increase by the week. And so I would be sure to make sure that you have told your provider the experiences that you're having, because there are opportunities to change your birth control so that you can have a better quality of life. Trying to think. One other side effect I was trying to think about. I'll probably think about it, girl.
Okay. Well, this is one of the big ones. Weight
gain.
Yes.
That's the one. I was trying to say that one for last because everybody talks about it. Everybody's nervous about it. Like none of us want to gain weight except for the ones of us that want to gain weight. And like, so the only birth control that is proven for you to gain weight is the Depo shot. Why? Because the progesterone in that makes you hungry. And as a result, you go eating. And people say, you know what? I have been snacking more at night. And then next thing you know, they're 10 pounds higher. Now, I actually did a study in my third year of residency on birth control. And I looked at all the different BMI classes for the Depo only, all the different BMI classes for their Depo shots. and how long they had been on the depot to see, like, okay, is there a certain BMI class that gains the most
Mm.
weight, or is it just all across the board? There were no specific categories of people that gained more weight than others. It's a free for all type of thing, and you just don't
Mm.
know how it's going to do with your body. I have some patients that they gain a lot of weight, and some patients where they're like, well, I got on Depo because I was hoping to gain weight, but this ain't doing nothing for me. Please give me some pills to help me gain weight. And so you just never know what it's going to do. But the average weight gain in general is about 5
Okay.
pounds.
So if
And that's for
someone,
the Depo.
so and that's, you said 5 pounds.
Is the average for Depo. That's the only one that's clinically, like, that's proven to gain weight. Now, yes, you can have some weight gain with the others or weight loss, but what I typically have people do is also to watch what they're eating and also to continue their exercise, because a lot of times people also change their activities and their weight gain may not be due to the birth control. It could be that now it's
Mm.
summertime and you're out of sports, and so as a result, you just kicking it and gaining weight.
Okay. That's actually a very good point. And the fact that you also said 5 pounds, because when someone comes in and they want to gain, they want to blame that 20, 30 pound weight gain on the depot, that's probably not it.
Well, I've seen it because I'm like, I haven't changed anything. But so that's the average. So of course that means there's more. Sometimes there's less for people.
Right.
But if, say for instance, their hormone is really giving them that hunger feeling, and they're like snacking,
Mm.
and they're like, yeah, like I have not been able to stop eating. Like I'm just so hungry. For them, yes, it could be due to the depot because they're overeating. So it is that behavioral
Overeating.
part to it, but the hormone is giving them that. So it would
Gotcha.
be, the underlying cause would be due to the hormone in progesterone, or the underlying progesterone in the depot shot. So for them, I'll be like, okay, let's switch you to something else for sure.
Okay. That makes sense. And I know you touched on acne and how it can actually help with that. Have you seen it do the reverse though, but where
Mhm.
people they start to break out with it?
Yes, I have. And it's really no respective person or a respective, like, different birth control, because everybody kind of has their own interactions. It's very rare, but typically I see that the hormones will help them, especially certain types. And we just switch them to something different and see if it works for them. And then we can also send to dermatology to see if they can get like a little extra support there.
Okay. So basically, what you're telling us is that we have options. And if something doesn't work, then be willing to try something else, especially depending on why you need it.
Right, right. That's definitely it.
Okay. Um, Now, one of the questions that someone reached out to me and said, now, guys, I want to let you know when I post the videos and stuff like that, comment, leave questions there. You can send them to my email, stuff like that. And someone did reach out. And one of their questions was they are in their 40s. They currently have that IUD. It's about time for it to be taken out. And they're wondering, should they get another one put in there? Because their concern is, am I going to go through perimenopause or menopause while this thing is in here? Do I need to start considering something else that's like a little bit, that's not a long term, maybe short term? Is this a good option for someone in their 40s? Is that just something for the younger people? And then maybe some of the older people should be looking at something else. So there are a lot in that one question to unpack. But what are your thoughts on that? Like an IUD for someone who's in their 40s?
Listen, 40-year-olds, the IUD is probably one of the best options for you because it's very, very highly effective. That's number one. Because I have some patients that be like, wait a minute, I'm in my 40s. Y'all gonna send me to the nut house if I find out I'm pregnant. Like, that's what they tell me straight up. They're like, look, I can't get pregnant. So, like, it's like you're busy, you have your children, you have so much going on. To change to something that's going to be less effective and depend on you to remember, compared to something that It's highly effective, and you don't have to try to remember it. You don't have to try to like maintenance it. You just go to your annual exam every year. That would just like not serve you much justice. So I say for this person that's in her 40s and it's time for it to come out, number one, what year did you get it? Because now it's FDA approved for 8 years if it's the Mirena IUD. So you can probably keep it another couple years. And then number two, child, get another one. It don't matter if you're going through perimenopause. When you are in your 50s, you can go ahead and remove it then, because then you know for sure. But the thing that you don't want is to find out that you're not in menopause with a positive pregnancy test.
Oh.
And one of the other things I was going to mention is that typically as we age, we find more medical problems that we are engaged with, whether it's like high cholesterol, diabetes, high blood pressure, anything. So as we age, the progesterone only and the IUD become some of our better options. And so, there are many reasons for someone who's 40, 45, 48, even 50, if they haven't gone through menopause, to have an IUD for your birth control.
Oh, okay. Now I just learned something, because you said even up to 50 and they haven't started it, that they can still get it.
Yeah, because the average age of menopause is around 52. And so you can actually still get pregnant. I actually had a patient that came for an annual exam, and she was like, "Yeah, I'm still having my period every month." And I said, "So what you on for birth control?" She's like, "Birth control." And so I was like, "Okay, so we're gonna have to put you on something if you don't want a baby right now." And she's like, "Oh my gosh," she was so embarrassed that she was gonna have to go home and tell her friends that she got put on birth control when she went to her annual exam. She was like, "I was coming for my mammogram, my pap smear and stuff, but she done sent me home with some birth control." Yes, ma'am, because you can get pregnant. You're still ovulating if you're having periods every single month. So a LARC is a great option for you.
Okay. Oh, this is so good. I love it. Well, do you have any other tips or comments that you would like to share for us?
Well, one of the things that I like to say just anytime we're doing education is, number one, these pieces of information is just, it's very general. Like we've talked about some very specific things, but it's still generalizable to the entire patient population. And so what I would recommend is making sure you research what you feel like is best for you, and also talk to your provider to have that two-way discussion, because it's always shared decision making. Like your provider knows a lot, and you also are the expert in your body. And so I think that you all should work together to figure out what you feel like would be the best option for you. And if you have any very specific questions, please don't take what we gave you today to say, "Oh, well, that's the answer to my question," because it may be, but if you have a very particular health background or something, you want to make sure that you're getting very specific answers to the questions that you have. If you feel that your provider is not listening to you about different types of birth control methods, or not, and there are some providers that actually don't offer like LARCs and things like that because it is a procedure, then you can ask for a referral. Don't be afraid to ask for a referral for other forms of birth control. The next thing I want to say is there's always getting your tubes tied. That is a non-hormonal form of birth control for someone who is sure that there will be no more pregnancies in this house.
Okay, good. Listen, you have shared so much, and the takeaways for me, especially as we're wrapping it up, was advocacy, speaking up for yourself, saying this is what I need, and making sure that you get that, having a partnership with your provider so that way you guys can both come up with a plan. And when you do that, then that means that it is customized and personalized for you.
Yeah,
because like you said, we are giving out general information and this makes sense over here and this is what it says. But then we also have to look at you and say, okay, but you also had this year and then you had this at that time. So then actually this one might be a better option for you. So
right.
just making sure that people are taking into account everything that's going on with you so that you can get the best care that you absolutely deserve. Well, thank you so much, Dr. Sims, for spending your time with us today and giving us some invaluable information. I really appreciate it.
You are so very welcome. I'm so glad that I was able to chat with you all. I actually just thought about one more thing though. Um, if you have a diagnosis of migraines and you can tell when they're coming, meaning a migraine with aura, combination birth control is not going to be the best option for you because you can actually cause a side effect of a stroke when you use
Mm.
birth control that has estrogen in it. Also, for women that are 35 and up and are tobacco users, you cannot use hormones. You cannot use the estrogen in the birth control because that can increase your risk for a stroke as well. So I thought make sure I said those because those are very like those are like some hard stops. There's a couple other stops, but those are like hard stops. Migraines with aura and over 35 years of age and tobacco use. No estrogen for you.
Okay. No estrogen for you. Well, tell them how they can follow you and where they can find you.
So living well with Dr. J. So living Livin without a G on the end. Well with Dr. J. Those are some new pages that I just started at the end of last year on Instagram, TikTok, and Facebook. You all are more than welcome to scroll through the page and look at some different educational, posts that I've made there. And if you enjoy it, then follow and of course ask questions if you choose.
Well, awesome, guys. Be sure to look her up because she is going to give you the real deal. She's going to tell you like what it is so that you will know. But she wants to make sure that you truly are informed. Make sure that you also keep those relationships with your doctors. We are so, so happy that you decided to tune in and watch today. If this was something that you're like, oh, this is really good, be sure let us know so that we'll know to keep putting out this type of stuff. Subscribe, like, share, all the things. And until next time, take care and we will see you soon. Bye bye.
Bye.